My name is Dr. Shaukat Mehman, kidney physician. Today, I'm going to discuss with you regarding the patient or female patient who becomes pregnant when she's already knowing she's suffering from chronic kidney disease. We know chronic kidney disease is the chronic condition which is not reversible. One has to live with that, and many of time living with chronic kidney disease is not as difficult. But when the female becomes pregnant, then this becomes a really challenge. A challenge of carrying the baby up to the 9 months and 10 days. Really big challenge, and some of the consequences may get her into the intensive care unit of emergency situations, like there is a problem in the growth of baby as well as the survival of carrying the baby to 9 months and 10 days. The control of the blood pressure till that, control of the renal function, I mean the control or stability of the chronic kidney disease, and other things like chronic kidney disease makes someone a little bit immunocompromised as compared to normal people. So getting rid of the infection during their pregnancy period. What happens some of the time, the female get elevated blood pressure or preeclampsia condition where one gets proteinuria. Some of the proteinuria is just leak from the urine, and elevation of blood pressure. That's condition known as preeclampsia, which superadd on that. Pregnancy make the outcome of pregnancy worse and end up into the need of dialysis during that pregnancy, and sometimes that dialysis is regular on daily basis, and the minimal dialysis at time of pregnancy during the pregnancy is 20 hours in a week, at least 5 days a week till ready deliver the baby. What happens? The nephrologists keep the urea level, which is the marker of the uremia. Uremia is actually the unwanted substance marker that's denoted by the urea, and the nephrologists keep that urea under 100, and to achieve that the dose of dialysis decided, which usually is 20 hours or 5 times a week. If that lady is lucky enough not having elevated blood pressure, not getting proteinuria, then does not need the dialysis as well, and pregnancy is successful. This can happen. It's not impossible, but the challenge is always what happens. One has to be very careful because symptoms are minimal, especially the younger ages, and one ignore and does not take the precautions and become pregnant, then these things become the regret for whole of the life. We have seen the lady losing their life, and if they do not lose their life but they become the dialysis dependent, even not at the cost of that surviving baby to which they desired or that accidentally happened, but that baby could not be delivered, could not survive, and that lady end up into requiring dialysis for her rest of life, and is nothing left than the regret. So we as a nephrologist do not usually recommend for pregnancy, especially someone who has a creatinine more than 1.5, and that risk even multiplies if that creatinine is more than 2.5, and one should really discuss the consequences, ups and downs, and the whole of the course of pregnancy. If some lady, despite of these things, want to have a baby, these consequences may happen, should be discussed before she embark on that journey. So this is the message one should keep in mind, and take care. And if you people have a question regarding that, you can write down in the comment box. Thank you very much. Take care.